Welcome to the Vaccine Hesitancy podcast. I'm Ty Branch, a researcher with the concept team at the University of Cologne. I'm also part of the Moral Obligation, Epistemology, and Public Health Research Group, examining the case of vaccine hesitancy. The aim of our research group is to inform philosophical discussion about the ethics and rationality of vaccine hesitancy. And to help us think about that, today our guest is Immaculada de Melo-Martín.
Thank you very much for inviting me to do this. I am very happy to be here. I am Immaculada de Melo-Martín. I am a professor of medical ethics at Cornell Medical School. My training is in philosophy, as I have a PhD in philosophy and a master's in molecular biology. And most of my work is in two different areas related but different. One related to philosophy of science, issues in science and values, and the other issues related to biomedical technology, science and technology, ethical issues related to those technologies.
So as we think about people's different reactions to the medical complex and science itself, you've talked about the idea of normatively inappropriate dissent. Can you explain that?
Yes. So the discussion on normatively inappropriate dissent, also called manufactured dissent or fake news, the overall term, is particularly related to science. So where people might challenge what is supposed to be the consensus. So in the case of climate change or in the case of the safety of vaccines, for example. So some philosophers have argued that there are some characteristics that this dissent has that allows us to identify the dissent. So, but the dissent, this normatively inappropriate dissent, presumably is dissent that does not contribute to the epistemic value of the research. So, someone is, presumably making things up in a variety of ways. And the argument that my colleague Kristen Intemann and I have made is that it is not easy to identify this dissent in a reliable way that would allow us to actually prevent the harms that dissent presumably produces.
So if it's difficult to identify and we're trying to develop communication strategies that maybe take into account people's values, how would you respond to those who might consider this attention to values manipulative?
Yeah, so two things that has, that we cannot identify this, normatively inappropriate dissent is that we cannot identify it in a reliable way that would prevent the harms before the harms happen. So one of the arguments that is often made is that dissent on climate change or on vaccines, the consequence of this dissent is that people don't get vaccines or people don't support policies that would combat climate change. So the dissent has social harms. Obviously, it has epistemic harms in the sense that people just have false beliefs, but it's particularly concerning the social harms of the dissent. People are just not going to support policies or behave in ways that would be consistent with the scientific evidence. So again, our argument is, yes, these are harms that this dissent can produce. The problem is that we cannot reliably identify when the dissent is normatively inappropriate and when the dissent is just, dissent that we are expecting scientists to have in a normal context. Because the point of identifying dissent, this bad dissent, is to try to prevent the harms. Then, we have to be able to do so before the harms have happened. So our argument is not that we cannot say this is actually bad dissent at some point, is that we cannot do it early enough and reliably enough that would prevent the harms. So when we are able to identify the dissent, it has already produced the harms that we are trying to prevent. So we can obviously try to minimize, try to prevent that this is going to continue happening. But it's, most of the strategies that have been used to do that haven't been successful. So that's what I mean by not being able to identify dissent. It's not that we cannot say people who are saying that vaccines, produce, give you chips that make you, that Bill Gates is gonna, be able to follow you all the time. Well, I mean, we obviously can identify that dissent as not epistemically reliable. But the problem is that, again, that has already produced harms, insofar as people have believed those claims. And then more serious dissent, related to whether there has been sufficient attention to certain kinds of side effects with the vaccines, So those are going to obviously be more relevant to people who are concerned with the safety of the vaccines. And of course, the same with the climate change issue. So just, we cannot identify this normatively inappropriate dissent early enough that would prevent the harms, and reliably enough so that we are not preventing actually dissent that would be good from an epistemic point of view.
So then let me rebound off of that, because it seems that with normatively inappropriate dissent, because we can't identify early enough which elements or which dissenters
Right,
are genuine,
right,
there's a degree of uncertainty
right.
that is part of this discussion of epistemic reliability. Can you speak a bit more to that?
Yes. So, I mean, we face this difficulty with this dissent, normatively inappropriate dissent, because we fear that it causes all of these problems, which again, people not supporting certain policies, behaving in ways that are not consistent with the scientific evidence. The issue is, okay, what do we do, given that we have this degree of uncertainty about when the dissent is not appropriate and when it might be, again, and we have this uncertainty, at least at the earliest stages before the harm has been produced. We also have the fact that people obviously, who need to make choices in the context of these kinds of disagreements. And how do we help people, how do we contribute to good decision making in a context that makes it difficult to determine, again, early enough, when this dissent is reasonable or not. So what kinds of things can we do that might try to deal at least with the uncertainty and the lack of mechanisms of criteria that would allow us to identify reliably and early enough this dissent? So what we argue is that, okay, we don't seem to be we haven't been able to find any criteria to identify this dissent early enough and, again, reliably enough. None of the criteria that have been proposed worked, and we evaluate them. So what other things can we do? Obviously, we shouldn't just give up and say, okay, well, there's nothing we can do. So what we argue is that maybe what we need to look at is the conditions under which the dissent is producing the harms. And our claim is that in a context where trust in the scientific community and scientific institutions is damaged, this dissent is more likely to have a hold on people. So that if we improve the social conditions so that we have warranted trust in scientific institutions and scientific communities, perhaps people are going to be less likely to believe these kinds of claims that we think are normatively inappropriate.
So, this attention to conditions, I think, is really important and interesting, especially because you argue that vaccine hesitancy is a combination of different issues. It has mixed causes, both if misinformation and a disagreement about values.
Right.
Can you talk about that more, and especially within this idea of the context that it occurs in?
If we have, I think this has to do with why do people believe, what presumably is misinformation? What is it about the fact, in spite of the fact that we, have all of these mechanisms to inform people, and presumably there are all these ways in which people can get appropriate information, in the context of climate change, we have been discussing climate change for decades. What kinds of policies might be more consistent with, preventing the kinds of damages that climate change is going to produce. So why are people not, believing these claims, and acting in ways that are consistent with, informed by the scientific evidence? So again, if we focus on the misinformation, then the solution seems to be, let's make sure that people are informed appropriately. So we are going to keep having campaigns about hitting people over the head with the information. We just need to have the right information. But if we think about what other reasons might exist that might make people, less likely to believe those claims, then we focus on the conditions under which, we are producing scientific knowledge. And then, in this context, questions about whether I trust the scientific community, whether I trust scientific institutions to give me reliable information, is going to be very important. So if we are able to produce conditions that are going to make people more likely to have warranted trust in scientific institutions, then even if there are people making stuff up, I'm not going to have reasons to distrust or mistrust the scientific community, and therefore I'm going to be less likely to be affected by those, normatively inappropriate dissenting views.
So it seems that publics are often asked to trust science through science policy. Is this actually the same as being asked to trust science itself?
No. I can trust that the information that is being provided to me by, the scientific community in a particular area is reliable. I can trust that policymakers are using that information in appropriate ways. And still, I might distrust the policymakers to be using other considerations in appropriate ways, so that leads me to reject the policy. So, for example, I can trust that the vaccines are safe, in what normally we understand by safety, because this is another problem with, when we talk about the safety of drugs. Many people, lay people might understand, well, that means that it's safe for everybody. If I take the drug, nothing is going to happen to me that is bad. But of course, we know that that's not the case. Safe means safe in relation to the benefits that it provides. So that obviously doesn't eliminate side effects. So in that context, I might think, okay, the vaccines are safe. I think that it might be appropriate for policymakers to now consider what policies are more likely to reduce, the infectious disease, that the vaccine is being used to prevent, and there are a variety of those policies that might be appropriate. So if policymakers say we are going to have mandatory policies for these vaccines, I might think, well, you haven't taken into account all of these other factors that are actually relevant to whether this is the appropriate policy. So I believe the science. I trust the reliability of the information. I think that policymakers are taking the science, as informing the policies that they want to develop, and still might think that policymakers have not taken into account all necessary considerations to determine what is the best policy.
So, when we talk about policymakers, this obviously happens in governments and, in our case, in democracies. So, you've spoken about this in your work about how differing versions of democracy can influence views on vaccination. Can you develop that here?
Yeah. So I'm not political philosopher. So just in general terms, we have, it's the discussions, for example, about climate change are very different in the United States compared to, many European countries. There are many reasons for that. Probably the types of democracy is one of those reasons, how people are likely to be elected here as compared to parliamentary democracies. I don't know that is the most significant difference, but certainly, those kinds of considerations are going to be relevant to how people are going to be paying attention to, certain kinds of claims made by politicians, for example, and how politicians are going to be using those claims in ways that might lead them to obviously be voted, uh, for their positions. So in that sense, we need to take, given that what we are concerned with is the effects of certain kinds of claims, scientific claims on policy making. We also want to look at those conditions that might make politicians more or less likely to reliably tell us about the scientific evidence.
Well, given the scope of your research that looks at not only how lay publics interpret science, but also how science itself is not only done, but challenged, and of course, how government takes this up, that creates an enormous amount of research to analyze. How do you think philosophers might better engage in this sort of interdisciplinary scholarship that you embark on?
Yeah, I think obviously working with people who have expertise in those different areas. So working with scientists in, how they produce knowledge, working with communicators, in the ways which might be better or worse to communicate information, and working with policymakers and policy advisors in what might be the best the things that need to be considered in developing those policies. So I think that, there is something, philosophers can do many things on their own, given the kinds of analytical skills that philosophers are trained to develop. But I think that there is something about working with the people who are doing this type of work that is important. That is important in how we might approach, the different kinds of alternatives that we might offer to, try to address these problems.
And in thinking about alternatives, what do you think the future of vaccination, both as a scientific endeavor and as a research topic, will be like?
Yeah, it's hard to say because I have often this fear, that as someone who works in this area, my perception of what is going on is a little bit skewed. in the sense that, because I am concerned with issues about scientific dissent and, how misinformation might or might not affect people. Um, Sometimes there is this feeling, that everybody is misinformed. There is an amount of misinformation that is just staggering. And so I fear that this is false. That this is a very skewed view of how the world really is, in the sense that, for the most part, the majority of people obviously are either taking the vaccines or vaccinating their children. It is true that there are, significant amounts of people that don't do so. But I think that, again, that we also need to focus on those who do, because in many cases, the things that have persuaded them, to do these kinds of things might be helpful in order to persuade others to do the kinds of things, to advance these types of policies. So it's hard to, I think that, again, if we keep focusing on misinformation in the context of, scientific misinformation, I think we are unlikely to solve the problems. Giving people more information, for the most part, if that's the only thing we do, is not going to help. We have quite a lot of evidence of that. So I think that the issue is, looking at, well, what is that persuades just normal people who might also have all kinds of, values that might be in conflict, with these policies, would be a good strategy. And also, trying to focus on the values aspect. How can we talk about values in ways that are more productive? I think it's very different for someone, for example, to have to say, I don't, I'm not vaccinating myself, against COVID, for example, because I am afraid that, I don't know, 10 years from now, they are going to discover that, there is some side effects that they haven't been able to discover yet. That seems very different than saying, I don't want to vaccinate myself because, the people who are dying are just old people. And who cares about old people? So these are two very different claims that people are not equally reluctant to present. So, it's very easy to say, I just think that this might not be totally safe. There are not many people who are willing to explicitly say, I just don't care about old people, even if that's what they are thinking. So the constant emphasis on the science allows people also to simply use the science as the excuse for, their behavior, when in fact, what is at stake here is that they have values that are, highly problematic. So what if we are able to have these discussions about the values in ways that are more productive, that might be helpful to the future.
So it seems like you're saying that there are likely disagreements about values hiding behind disagreements about science.
Right, right. And I think that this, I think one of the problems actually of the emphasis on misinformation, scientific misinformation, is that it's hiding this, because it allows people to always fault the science, rather than having to face, confront the fact that there are, that they have values that might be problematic or not, but that is an issue about values. So this is problematic, for this reason, because again, we are not having productive conversations. I just excuse my behavior on grounds that, there is uncertainty. But it's also problematic because if I don't want certain kinds of policies to be passed, if I think that, I have stakes on oil companies, and I have no interest in the fact that we're going to have policies that constrain oil use, then I have a very good incentive to try to find problems with the science, even if those problems are, just made up. Again, I have a good incentive to produce normatively inappropriate dissent. So when we focus only on the science, first, we allow individuals to excuse their behavior by simply, using the science. But we also are likely to give people, those who are interested in denying or impeding, certain policies, we also give them a mechanism that is very, very useful in trying to prevent public policies that go against their interests. So on both of those grounds, I think the focus on scientific information, is obviously problematic.
Immaculata, thank you so much for sharing this rich interpretation and understanding of how vaccine hesitancy is a complex problem at the intersection of science and society.
Thank you so much. I have enjoyed very much talking about this with you. So I hope that others do too.
Thank you.